Welcome to Marian Ayurveda. In this episode, we are going to discuss the growth of the adenoid gland in children, which can cause breathing difficulties, affect their studies, lead to hearing loss, or even alter the shape of their face. We will also talk about the causes of this condition and the various treatments available in Ayurveda for it. I am Dr. Anumod Kakkassery, Marian Ayurveda, Thrissur. One of the major concerns for today's parents is the growth of the adenoid gland in their children and issues related to this growth. When this adenoid gland grows, especially when it grows excessively, we know that children tend to have persistent fever, cough, or their immunity decreases, and it can even affect their hearing. This is a major concern. Often, mothers come and say that when they see their child struggling to breathe, especially at night, sitting up and having difficulty, it causes them a lot of anxiety. So many times the only solution that is suggested for this is surgery. In my practice alone, we must have treated around 1,000 cases of children with adenoid gland enlargement in our clinic. Very often the concern of parents is whether such a severely enlarged gland can really be reduced with Ayurvedic medicines. I often take x-rays of the children who come to our clinic both before starting treatment and after completing it. At that point itself, we can observe a very significant difference. At the end of this video, we will be showing the x-rays of children taken before and after treatment. So if we move on to the main reasons for this, I feel that there are 3 important causes that we have identified. First, children consuming foods that are excessively high in fat, that is, foods like nuts, tapioca, cashews, peanuts, almonds, or eating boiled plantains cooked in ghee, regularly eating boiled eggs, or items like cheese, butter, and other dairy products, yogurt. In children who eat such foods, we have seen that their adenoid glands fill with phlegm and become enlarged like a big lump. In such children, what we need to do is reduce their phlegm. When you touch the foreheads and necks of children who have a mass of phlegm filling the adenoid gland in their heads, you can often feel a distinct warmth, noticeably warmer compared to their cheeks. This means that there is an excessive accumulation of phlegm in their heads. So, in such children, by using medicines that reduce phlegm alone, it is possible to shrink the adenoid gland just by using those phlegm-reducing medicines. The second group of children are those who have allergies. One thing about them is that their parents also tend to have dust allergies or other types of allergies. The second fact is that adenoid enlargement due to allergy is often seen in children who excessively consume tea, coffee, or items like pickles, papadam, or sour foods. Once when some parents came to see me, their child was having a lot of difficulty at the time. After examining them, I realized that the parents had a strong allergy and the child also had a strong allergy. So, for the allergy, I gave medicine that would reduce the allergy of the adenoid gland, and within just 3 days, there was a significant improvement in the child. Then immediately they went and did an endoscopy again. They had done an endoscopy initially as well. Within a week or even just 3 to 5 days, we could clearly see in the endoscopy that the adenoid gland had become smaller, noticeably reduced in size. What we understand from this is that adenoid glands caused by allergies can be reduced within days or even within just 2 or 3 days. At the same time, there is another condition that I mentioned earlier. That is, if you consume foods like tapioca or yam or continue eating things like boiled eggs, the adenoid glands that develop due to phlegm accumulation will take more time to reduce. But we can see the initial results within a week itself and the child will be able to sleep comfortably. However, it usually takes 2 or 3 months for changes to appear in the X-ray. The third type of adenoid is seen in children who have a higher incidence of worm infestations. In children who consume excessive sweets, worms tend to increase and this can lead to an allergic response. So, in such children, when we reduce allergies and also add medications that decrease worm infestations, that's when we see a reduction in the adenoid gland. In very rare cases, when we examine the throats of some children, we can see that their tonsils and adenoids are very reddish and inflamed. In addition to this, for such children, we may also find it necessary to give specific medications that work to reduce the local inflammation or the excess fluid retention in their throat. So if we approach the treatment by thoroughly understanding the root underlying cause in this way, it is important to note that even adenoids with 100% blockage or those with 95% blockage can be successfully treated, managed, and resolved very easily. Now, the x-rays that we are going to see in our video are mostly of adenoids with 95 or 100% blockage, or we have only taken endoscopies of such cases. In almost all of those specific cases, within just a few short weeks or months, we have actually been able to very significantly reduce their overall size. In conclusion, to wrap everything up today, issues related to the adenoid glands are not something that we should ever be afraid of. With the right diet and proper medications, we can effectively treat and completely cure them. With that being said, let's end this video here. I look forward to seeing you again in another episode. Thank you so much for watching today.